Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone, and welcome to the Hair Loss Show. My name is Dr. Vikram Jayaprakash.
I'm Dr. Russell Knudsen.
Welcome to episode number 30. So thanks again to everyone who's subscribing and liking our videos. If you've got any comments, please leave them in the comment section below. If you've got any questions, we're really enjoying those and hope you're enjoying the feedback that we're giving as well. So today's topic, we thought this is something that we get asked a lot in our on the comment section in our questions, and it is about treatment, and that covers the whole spectrum of treatment. When is a good time to actually start treatment?
Okay, I think the way I describe that, Vikram, is that first of all, if we have a concerned relative, typically a mother, coming in with a young man wanting to know what's the right time to commence treatment, the first thing I'd say is that we as doctors have to be convinced there's something that's treatable. Okay, so if you come in and you're complaining about increased shedding, that doesn't necessarily mean we're going to treat it, because if that's a temporary increase in shedding, then it'll settle by itself.
Yeah.
So we would have to see evidence that we thought there was a progressive problem developing. And if we can find the evidence, then that is the right time to begin treatment.
So first of all, we've got to make sure that we've got the diagnosis correct.
Yes.
If you're losing hair, what is the cause of that hair loss? And that's why getting in and seeing someone and finding out what is the cause of your hair loss. So for most of the time, what we're seeing is people with androgenic alopecia. So if you're male pattern hair loss. So the question is, I'm losing my hair. So when is a good time to start treatment?
Okay, so the answer is that because we like to use our video microscope, which is a 50-power magnification, and then previous episodes have demonstrated what the hairs look like when you magnify them 50 times, it's very easy for us to be able to decide if we think there is a problem developing with deterioration in the quality and the number of the hairs. We don't have to take photographs, because photographs are notoriously unreliable, because it's affected by lighting, camera position. Are you exactly in the same spot on the scalp? Which is why when we use scientific trials, we usually put a tattoo in the scalp so we can center the camera on the tattoo to make sure that we're doing counts or we're looking at exactly the same area.
And this is a valid point, because I get asked lots, look, if you're monitoring, do you take high resolution photography at various points? How do we know if the treatment is successful? My general comment about that is, you're going to be the one who's going to tell me how successful the treatment is, because again, as Russell was saying, if you want to look at a particular area under a microscope and say, well, we've started treatment, well, is it the same? Is it slightly better, or is it deteriorated? You've got to make sure you're photographing the exact same area, and that's exceptionally difficult to do.
That's extremely difficult to do. So we look at these magnifications and we decide whether we're seeing something or we're not seeing something, because I like to joke with my patients that if they think they've got a problem, they have developed X-ray vision. And what I mean by that is, and I say this to the patients, is you guys don't look at the hair anymore, you're looking through the hair, you're looking for scalp. And if you start to focus on looking for scalp, you're always going to see it. And you could have essentially a normal head of hair, but now because you're looking at it a different way, you can't see the wood for the trees, to use an analogy, because you're just viewing it differently. So we first of all want to show the patient, as much as ourselves, what a normal healthy hair looks like, and then compare it to the area that they are worried about. And if there is a difference, then it's worth treating, because it doesn't matter what medical therapy or laser therapy or any therapy really that's short of surgery, it doesn't matter what you use. The current technologies teach us that we're better at preventing deterioration than we are at regrowing hair, particularly if it reaches a certain degree of thinning. So the bottom line that we would use, based on the evidence, the research we've seen, is that if we can get to a hair before it gets to 50% of its original size, we have a chance to turn it around and make it thicker. But no trial that's ever been done in hair loss products in the world has ever demonstrated that a hair, once it gets down to less than 50% of its original diameter, will ever come back and be a fully strong, healthy hair again.
That's right. And so, I mean, feel free to have a look at one of our previous videos. We did one on miniaturization. We looked at pictures and demonstrating this. And this is a point that's been raised a couple of times in the comments. People talked about, oh, I had very thin hair or no hair, and I started treatment and suddenly the hair grew back. That may happen, but it's not because there was no hair and all of a sudden the medication, caused you to grow a new, brand spanking new hair in a particular area. What it meant was that there was a dormant hair follicle underneath, and that stimulated that to grow. So, but I think the point is clear, and we're clear on that, which is that if you're having miniaturization, you want to get in before that 50 micron mark, because if you can start treatment before then, you've got a much better chance of pulling the needle back to better thickness or increased thickness.
So, basically, the youngest patient I ever saw that showed signs of early miniaturization was a boy of 8 years of age. So this is like precocious puberty, if you like. What we mean by precocious puberty is starting early. He obviously was having some influence from the small amount of male hormones in his system at the age of 8. Now, if you've got someone in that exceptional circumstance, probably the only thing we're going to offer to an 8-year-old is something like minoxidil or laser. We're not going to give them finasteride. We're not going to play with their hormones because they're going through puberty. So the critical thing about that is, yes, we think finasteride has a better long-term effect than minoxidil and a better long-term effect than laser, but you have to be sexually mature before it's appropriate to offer that medication. So for most young men, if we're talking about men, for finasteride, we would say you have to be at least 16 to be on therapy. And even today, I saw a 16-year-old young man. He's almost 17, and he's been on finasteride now for 12 months because we felt that was appropriate. He's responded very, very well. He's actually improved in the last 12 months at 16. Good. So it is not too early at 16 to do it, but we would be very reluctant to be using things like finasteride in someone who is still going through puberty and hadn't reached the end of puberty.
I remember you said 8 years. That's really. I mean, we spoke. I had a patient I think was 12, and I remember speaking to you about that as well. And we've in those scenarios, and thankfully
it's rare. It's rare.
It's just pushing through to that period where where they are hormonally mature enough that you can start on treatment to try and stop. So briefly going back over that, finasteride, what it's doing is it's blocking that 5-alpha reductase enzyme that's blocking the conversion of testosterone to dihydrotestosterone and lowering that at the level of the hair follicle, which will hopefully stop that miniaturization process.
And we will get to this in a future episode. We'll talk about microdosing and customizing dosing to individual patients and give you our rationale for it. And one of the reasons I want to do that as a specific video is because we're getting questions about microdosing and about how long it lasts and does this add extra and doesn't. And we'll work through that, because I think that the idea of customization is that not all patients are the same. And so because we're looking at a whole different variety of patients with different varieties of baldness and what I call the aggressiveness of baldness, then we have individual tailored plans that try to address that, because the key is to keep the hair. So just to summarize again what we just talked about, medical treatment begins when you notice a problem. Which type of medical treatment you use depends upon the age of the patient. Now, if we go to surgery, because that's another important part of this, when can you start surgical treatment? We are generally reluctant to operate on very young men. And there are a number of reasons historically why that would be true. Number one, we had nothing that was preventing them losing their hair if they were very young. So it was kind of like quicksand. They're losing hair and you're topping them up, and they're losing hair and you're topping them up. And you never made them happy, because even in my experience in my early years, some people were losing hair faster than I could replace it.
This was before you started them on finasteride, before finasteride became...
Before minoxidil even.
Before minoxidil.
In the 1980s, I know that makes me old, but in the 1980s we didn't have minoxidil, and we certainly didn't get finasteride until the 90s. So back then there was nothing you could do except operate. The other thing is that the younger the patient, usually the more panicked they are, which made them emotionally very, very labile. and they made poor decisions in panic mode, and you didn't know what the outcome was. And the reality is, there is what I've discussed in a previous podcast, what I call premature balding. If a patient comes into me and says, I hate it at the moment, but in 5 years or 10 years time, I wouldn't care. Well, that's not a surgical candidate in my book if I can avoid it, because surgery is permanent and they have to deal with the consequences of the surgery permanently. Whereas if you put them on medication for that 5 or 10 years and can get them over the hump so that they then become comfortable with it in their own skin. The worst moments in my life have been the 29-year-old patient. I think there's two, I think there's one, who came back to me. I'd operated on him at 19. He begged me, his mother begged me. I operated on him at 19. He came back at 29 and said, I wish I'd never done it, because now I have to live with the consequences of it, so now I don't care about it. And that, for me, as a doctor, is devastating. Right? I should not have given in to the emotionality of the situation, because now I've left him with lifelong consequences.
And that's the key here, because hair loss is a very emotional thing. And if you're young and you're starting to lose hair, it makes, it's anxiety, it causes anxiety and all sorts of tension. So there is this push to say, right, you know what, I'm losing hair, I want to
fix yesterday.
I want to get on board, I want to do it. And one of the things that one of the things I'm actually very proud of is we're actually very, very conservative about, both of us, on who we operate on. Correct. And especially in younger people, we're really about pulling it back and going, let's rein it in. And
the big advantage we have now compared to the early era is that we have good treatment options for them, and that makes it a very, very important time to take that pause, because any individual hair can only be moved once, which means there is a lifetime supply of donor hair that we can do in our patients. But I like the patients to be able to demonstrate to me over at least 12 months, that the medical treatment program is working and that we've got control of the process and that we aren't going to be chasing our tail on this one. So the advantage of it is it slows the process down. It allows everybody to assess what's going on, get a calmer view of it, and make a better decision rather than operating in panic mode.
So why do people regret it? I mean, that's the key, and this is why we're quite conservative, is because let's just say someone's losing their hair and their hairline's moving back, and you go, right, I want to rebuild that frontal area. Well, first of all, we've got to take hair from the back and then transplant it into the front. This is a non-renewable source, all right? So think of this as your savings account for hair. You're born with a certain amount of hair or money in your savings account.
And there's no interest payable.
No, and you can't make deposits. All right, so whatever withdrawal you make, that's got to last you a lifetime. So you've got to plan for the next however many decades, is potentially there that you're going to lose hair. And let's just say one of the worst outcomes is that you're losing your hair, you transplant the front, and that looks great, but you continue to lose hair and the hairline starts moving back behind that. That's going to leave these sort of horn-like structures in the front, and it's going to look odd, which is going to force you to have to come back and do another procedure to try and fill that up. Now, how many times or how often can you come and chase that? Well, that's a topic
that can be explored in greater detail, but because it's going to depend upon the degree of balding. I mean, one way to think about it, people, is that the balder you are, the less resource you have to deal with it. Right? You've got less hair left on your head, the balder you are. So it becomes much more difficult when you've got extensive balding, and baldness is progressive. So what I say to my patients is this, that the worst thing that can happen is if you stop your treatment program is you will bald naturally, the medical treatment program. The worst thing that can happen if you have the surgical program and your hair continues to bald away is that you will now bald unnaturally.
That's correct.
And if we don't have donor hair left to actually deal with that progression of the hair loss, then you're going to be permanently left with an unnatural pattern of balding, and that's a tragedy for the patient. And so that's one of the things that makes us super careful about this.
So we don't want to sound like we're against surgery, because that sort of goes against what we do on a...
It's part of the armamentarium, but it's not the beginning point.
No, that's right. And so it's something that if you're going to undertake that, you should be counseled appropriately. It should be a well thought out and well planned out, so that you know the lay of the land. What are the pros? What are the cons of going down this pathway? And do I have a plan B and plan C should the worst happen going forward?
So this is a long-term planning exercise, and the thing about hair transplant surgery is that a lot of people think that it's a simple exercise. You just cut the hair out and plant it around the front. That's in the moment. That's not thinking 10 years down the track. That's not thinking 20 years down the track. The key to surgical planning is not what it's going to look like in a year's time. The key to surgical planning is what could it look like in 20 years' time, because you have to deal with the consequences of that. So we'll explore that in more detail in future episodes. But we just wanted to give you an overview today that the starting point for us is, if we see a problem, we're prepared to treat it. Now, how we treat it will depend upon what we see and what you've done in the past, if anything, and also the likelihood that you'll stay on the treatment, because there's another question we get all the time, is if I start the treatment, how long do I have to keep doing it for? And the answer is, we aren't curing anything, we're managing it. That means it only works if you take it. And even then, over time, and we'll discuss this again in a future episode, over time you could still progress your hair loss even if you do everything we ask you to do. So it's slowed the leak down to a trickle, but it hasn't stopped it. Because people say to me, well, I've heard that after 5 years, your body becomes immune to it and doesn't work anymore. And that's a misunderstanding of what's going on here.
Right. So I think that's a great point. And just to sort of summarize it, is when is the right time to start treatment? Well, when you start noticing that your hair is thinning, that's probably a good time to take advice, and then make sure you got the diagnosis correct, and then have a look at your treatment options. And if there are certain treatment options that are appropriate for you, by all means, start that under medical supervision. And that's starting from the medical therapies, and we've talked about that before, with things like Finasterid, with minoxidil, topical or orally, with low-level laser, and then progressing onto the surgical side of things. We don't like surgery being the number one thing on the list of, on your management plan. It's got to be, in conjunction with other treatment modalities. But that should be part of the plan. But in terms of timing and surgery, we're probably very conservative, and ideally don't want to undertake the really young population, undertaking surgery in someone who's really young, which is ironic because it's the really young patient that really wants to have surgery.
So if I was going to give you an overview of it, I'd say you've got to be approaching your mid-20s before we're going to start to be comfortable about it.
Yes, that's right.
So I hope that's sort of clarified the issue just a little bit for you today. We again thank you. We're really humbled by the number of subscriptions that are coming in now, and the number of views, and the questions and the comments and the feedback. It really is good for us to understand what you care about and what you need more information about, and we'll endeavour to continue to respond to that as we go forward. So thank you for listening to us again today, and we'll look forward to talking to you again.
Thanks very much. See you next time.